So I'm Dr. Julie Gunther. I own Sparkin Dee, which I founded in 2014 in Boise, Idaho. I finished residency in 2009. I actually delivered my firstborn 2 weeks after I graduated from med school, which was actually on today, 14 years ago. And then I took a year off and went to residency in Indiana. Graduated in 2009, started with, like I said, the big hospital system, worked there for 5 years, and then founded my own small micro practice in 2014. So Sparkin Dee is a direct primary care practice. It's not a chain. I came up with the name. Actually, my husband and I came up with the name while we were sitting at Starbucks. We wanted something that was energetic, but also a word of renewal. We thought about Phoenix, but that's an often used name. And where we live in southwestern Idaho, we actually have 5 seasons, spring, summer, winter, fall, and fire season. So Spark is something to me that's very meaningful, a meaningful start of restoration, actually, because once you burn something down, particularly something that doesn't work, it has the opportunity to fully renew. So I left, like I said, I left my employed position, left my salary, we sold our house, sold our cars, and I had the opportunity to buy a small business in downtown Boise, which is a growing, maybe almost metropolitan area now, at a great deal. And for 5 years we operated in that small space. I started with 0 patients and partially informed my prior patient population. I was a little restricted by my contract, and just grew 1 patient at a time. After about 3 months of being open, I added a nurse who was my nurse previously at the big system. And 5 years in, we now have a nurse practitioner, a physician assistant, myself. We have an aesthetics division and 2 nurses, and we're at about 700, 750 patients. So direct primary care is an important phrase. It's actually a phrase that's rolled into the Affordable Care Act, which was passed in, I think, 2010, which designates a direct cash pay model to a physician as an acceptable care delivery model when bundled with a wraparound insurance. Some of that is changing with our current presidency, but it's just the simplest form of trade. I'm a board certified family physician. I'm actually dual boarded. I also have board certification in hospice and palliative medicine, which is work I did to support the business during our startup years. And so our patients pay a flat monthly fee, and we have 3 pay tiers. We have a pediatric tier, which is actually, I'll just say, less than, I don't know, a bottle of water every other day. Sometimes we can't commoditize things on these interviews, but pediatrics are $10 a month, adults are $79 a month. Anyone over the age of 90 or on hospice is $1 a year. And patients pay a flat membership fee. And then anything we can do in the outpatient setting with my training, we do. So procedures are essentially included minus a suture fee. Major joint injections are $10. We have an in-house dispensary. We have 330 generic medications. Most of them are about 80% of the cash-based cost at the local pharmacy. For physicians that are maybe listening to this interview, they might be surprised to learn that one of the most commonly prescribed antihypertensives, a drug called hydrochlorothiazide, is $4 a year when patients pay cash. So we try to nickel and dime backwards to save people money. We also have cash transparency, and we try to remove most of the stress out of the healthcare transaction.